Hi, good afternoon. This is Ellen Breslin from HMA out of the Boston Office of Health Management Associates. Welcome to the webinar, The Housing Imperative for Persons with Disabilities to Advance Independent Living and Recovery. It is October 31st, 2024. Happy Halloween to folks out there. We're going to begin this webinar today with a few introductions and a wonderful conversation with Olivia Richard. So by way of introduction, my name's Ellen Breslin, a principal I noted out of the HMA Boston office. I am here today with my colleagues, Carmen Daniels-Jones out of the Atlanta, Georgia office, Anthony Federico, out of the New York City office, Anissa Lambertino out of Chicago's office. And we are also joined by Allie Cannington, the Director of Advocacy at the Kelsey, R. Fenham, Director of Advocacy at the Disability Policy Consortium in Boston, Olivia Richard, a disability rights advocate out of Boston, Massachusetts, and Barry Whaley, project director for the Southeast ADA Center at the Broaden Black Institute, Syracuse University. We have a wonderful collection of people today, and to elevate the voices of persons with disabilities. It is a housing imperative for persons with disabilities to advance their independent living and recovery. Today, we're going to understand more about the impacts of affordable and accessible housing on persons with disability as seen through an equity lens. We'll examine the state of affordable and accessible housing for persons with disabilities. Will broaden your understanding of the impacts of race and income, disability and geography on access to affordable and accessible housing. We'll also learn from our expert panel members about the ways to expand housing for persons with disabilities. I'm the first of the lineup today, and I want to underscore there's been a lot of work done thus far, but obviously we have much more to do. We were inspired by the PBS segment, by people with disabilities facing extra hurdles, and the attention that Judy Woodruff brought to the affordable housing shortage. This is all about dignity. It's about independent living. It's about recovery. And so that is why we make this an imperative here. Turn the slide, please. This is a picture of what we want to do, which is operationalize independent living and recovery. This is the goal. This is our hope, that with affordable housing, plus accessible housing, plus community in which people can thrive, plus the right types of supports in the community, the services and supports, the Medicaid coverage that one needs to support their home and community-based services, their mental health and substance use services in the community, and the peer supports they need to live independent living, independent lives with dignity and a quality of life with positive health outcomes. And so as we turn the page here to just review a few facts, and these will be later shared in multiple forms today, which is that we have 1 in 4 adults with some type of disability. We have 12.5 million people who are dually eligible. We know that dually eligible individuals are disproportionately low income. We have wonderful key reports to explain the market, from the state of the nation's housing to priced out to beyond the minimum. And these are reports that really align very nicely with this webinar today, which is that we need more affordable and accessible housing. Anissa will highlight some of the issues around how hard it is to celebrate the 25th anniversary of Olmsted. Well, many people do not have access to the home and community-based services that they need. We need more of that state and federal funded support to advance the housing rights for people to live in the community and thrive in the community. She'll review that state variation today. And as we turn to the next slide, we take a peek at the intersectionality of race and disability. So it's not just the ableism and the stigma that comes with disability. It often, sadly, comes with classism and racism, and where we see the American Indian, Alaskan Native population and the Black population, where 3 in 10 persons have a disability, 1 in 4 have a disability. We know we have our work cut out to us in order to advance not only independent living and recovery, but also health equity. And so what I'd like to do now is center this presentation today, webinar today, around an interview with Olivia Richard. Olivia Richard, I should have done this image description of myself at the beginning. I am a white woman, 60 years old, with graying hair and wearing a black sweater. Olivia, I want to welcome you to this webinar, and so that we can have a conversation about your experience. Hi, Olivia.
Hi, my name's Olivia Richard. I am a 40-year-old white woman, currently wearing a blue striped shirt, and I have close cropped brown hair and glasses.
Thank you for being here, Olivia. As we talked about the other day, and we've known each other a long time in these Boston circles, and so it's just really a pleasure to have you here today and center this webinar around a conversation with you. Olivia, the first question I have for you, and we kind of talked about it a little bit the other day, which is, how is your housing situation, Olivia? And when you think about it on the affordability and accessibility access.
My housing situation is stable right now. I live in Section 8 through RAD, the rental assistance demonstration from HUD, the Housing and Urban Development of the Feds. So my rent is 30% of my income, which is SSI and SSDI.
And so that's fabulous. So 30% of your income as compared to something outrageous like a 60% of your income.
Absolutely, yes.
And I wonder if you could tell us a little bit about what the accessibility features in your home, in your apartment, and what makes it work for you.
Sure. I have an automatic door opener so that I'm not having to bash the door open with my wheelchair every time to get in and out. The counters are low. I have a roll under sink and a roll under stove. And my oven is built into the wall. I have a bathtub, which works for me. But I've got a lift for it.
Okay, but you mentioned, so the door in and out of your apartment, the kitchen is accessible, the bathroom could use some improvement, but overall, how would you say, how accessible is your apartment? Would you give it an 80 or a 90%, or would you say
overall, I would give it like an 80-85%. I mean, it is absolutely so much better than what I had before.
Okay. Yeah. And if you can share a little bit more about, um, what you had before, but also I think when we spoke before, you landed in a better situation, unfortunately, because of something that wasn't working for you. And I think you mentioned a kitchen fire.
Correct.
Okay.
Correct. I was living in an inaccessible apartment. I had left the nursing home early without moving to an accessible place because I was just like, get me out of here. I'm going to lose my apartment if I had stayed any longer. Um, my place, the kitchen was not wheelchair accessible. I couldn't reach the the stove safely, and my sleeve caught on fire.
Oh my gosh. Okay. And fortunately, needless to say, I hope you weren't hurt by that.
No, no.
I mean,
Thankfully, I'm the child of a firefighter, so I learned baking soda is your friend.
okay. But I don't mean to underreact. That sounds actually absolutely frightening.
It
You have your
was.
sleeve go on fire. And so what were some of the steps you took in order to move forward in this? What did you have to do to advocate for yourself to get better housing?
Sadly, it took a bit of nepotism, uh, where I had called the administrator of the BHA directly, of the local housing authority directly, and told him what happened. And he flipped out naturally and put into motion my move within a month.
Wow. Okay. So to summarize what I heard from you today, you were in a nursing home, you got housing, it was not accessible and sufficiently safe for you, and then you advocated for yourself and you got better housing. So
Correct.
how many people are in your situation today where you got what you needed? It's not perfect, but it's a lot better. And what advice would you give to them?
There's not a lot of people that are in my situation. Sadly, it's something that it should be the norm to have housing that is linked in accessibility and affordability, and in a community of your choosing.
That's the agenda for today. Thank you for setting forth with such clarity that your experience should be everybody's experience, but not born out of a very scary event leading up to that.
Exactly. It shouldn't take an almost tragedy to,
To get housing.
yeah.
I want to thank you. This is a very short interview because we have a stacked agenda here to bring forth all of the aspects of this. Thank you very much for being here, Olivia. And I look forward to seeing you around town. And I'm going to pass the webinar now to Anthony Federico.
Thank you, Ellen, and thank you, Olivia. Hi, everyone. Very happy to be with you all. I'm Anthony. I'm a senior consultant in HMA's New York City office. I'm a white man in my 30s with a blurred computer screen background, a button-down shirt, and a blue jacket. My background is in housing and homeless services and healthcare. I lived and worked in the San Francisco Bay Area for 15 years for a housing CBO, and then also for local government. I have 6 short slides, and the intention is to provide some more information and data as background on the national housing crisis and in general, and specifically as it relates to people with disabilities as well. So on the next slide, housing is simply out of reach. In California, you need to make $42.25 an hour to afford the rent on an average 2-bedroom apartment. That's equivalent to $88,000 a year. That is right around the state's median household income, leaving over half of households unable to afford housing. This is common in many states. You might think to yourself, California is more expensive than a lot of other places. There's some truth to that, but other states often have lower median incomes too. So the challenge is throughout the country. Housing instability is widespread. So in housing and housing policy, there's a concept called that housing cost burden. And that's when a household is paying over 30% of its income on housing costs, whether that's rent or mortgage payments. That is the situation that over half of the nation's renters find themselves in. And then finally, there's a large and growing body of research that shows very strong links between housing and health outcomes. Some of these are expected, some of them, for me at least, are shocking. For example, a relatively recent finding that links housing instability to lower infant birth weights. On the next slide, there's just a little more background here on those strong links between housing and health. In general, I find that in our national housing conversation, we spend a lot of time on the affordability piece, and we will do that here in this webinar some more, but let's pause for a moment and look at some of the housing challenges other than affordability. So there's location. If you live in an area with safe streets, few car accidents, in an area with great jobs, maybe it's a job center, it's in a good school district, that is very positive and beneficial for you and your family and for your health. Next, quality. Housing quality refers to lead paint, asbestos, pests, mold, allergens that can trigger otherwise avoidable asthma attacks. These are the housing quality and quality and habitability issues that lots and lots of people are struggling with. Another one would be overcrowding. There's research that shows that child math scores go down as the number of people living in a house per bedroom goes up. And that's even after accounting for socioeconomic status. Another very troubling finding on housing quality. On the next slide, let's look at how some of these issues affect not just the general population, but people with disabilities. So there are barriers and discrimination related to employment that lead to a much lower employment rate than in the general population. And then looking at that box on the bottom, there's so much documented evidence and lived experience on barriers and discrimination related to the accessibility features that Olivia and Ellen were just talking about. This can be owners declining or refusing to put in those home accessibility features. This can be failing to provide dedicated parking, making it difficult for a renter to receive home care in the home. All of those things are required under the Fair Housing Act, but oftentimes that just does not happen. And on the next slide, we're returning for a second to the affordability issue. We already covered the housing cost burden. There's also something called the extreme housing cost burden, when households are spending upwards of 50% of income on housing costs. So here we can see that people with disabilities across owners and renters are faced with that extreme housing cost burden. All right, next, this is the last slide covering the big picture national housing crisis landscape. This research comes from partners at Technical Assistance Collaborative, TAC. Since 2007, TAC and their partners in the Consortium of Constituents with Disabilities have produced this report called Priced Out, and it looks specifically at housing challenges for people with disabilities who depend on SSI, supplemental security income, as their source of income. I think the main takeaway here is the small number in the middle of the slide that says on average across the country, people who depend on SSI have to pay 142% of their SSI to afford an average one-bedroom apartment. So this does not work. This is broken. I don't know where that extra 42% is supposed to come from. And that still leaves nothing left for other necessities like food, clothing, transportation, etc. So with that, I'm going to turn it over to my colleague Anissa to walk us through some of the state level housing landscape issues.
Thank you, Anthony. My name is Anissa Lambertino. I use the pronouns she, her. I'm an epidemiologist by training and a Hispanic woman with dark hair. I'm wearing a grayish sweater. I specialize in data analytics and data visualization as a senior consultant in HMA Chicago office. The maps in this section tell a story through compelling visuals that reveal conditions of disability, HCBS as a percentage of LTSS, and fair market rent for a one-bedroom apartment in the United States. Alaska and Hawaii are included in the analysis, but not shown. I analyze these indicators as standalone measures, as well as in two variable maps known as bivariate maps. Next slide, please. I will show 5 maps to better understand state conditions that reveal opportunities to focus or tailor outreach or services using a data-driven and comprehensive approach. We present high-level findings on this slide, and we'll review the findings visually over the next several slides. Next slide, please. This slide is also for reference. Map 1 presents disability prevalence with darker shaded states indicating higher prevalence. The color legend above the map shows the range as 13 to 23%. The map allows us to see the geographic distribution and clustering of high disability prevalence in the southern United States. The box and whisker plot on the top right shows the visual distribution of data points across the measure, including a range, outliers, the median or middle value, and where the most data points lie. Outliers above the upper hinge of the box and whisker plot are West Virginia, Kentucky, and Arkansas. The table on the bottom right displays the descriptive statistics in tabular form, and I included the 33rd and 66th percentile, as these values are thresholds I use to create low, medium, and high categories in the bivariate maps to follow, with approximately 1/3 of the states falling into each category. Next slide, please. Map 2 displays the range of median rent as $635 to $1,800, with darker shaded states indicating higher rents. The maps show clustering of high rent values generally occurring along the coastal United States. And high outliers for rent, shown in the box and whisker plot, include Washington, D.C., Hawaii, New Jersey, and Maryland. Next slide, please. Map 3 displays the percentage of LTSS spent on home and community-based services. The range across the states vary from 32 to 84%, with lower values indicating greater adversity. Mississippi has the lowest value, and the box and whisker plot shows that there are no outliers. Next slide, please. So geospatial bivariate mapping tells a story through compelling visuals that reveal the relationship between two variables in the context of geography. Map 4 illustrates the relationship between rent and disability prevalence. The color legend below the scatter plot shows both measures categorized as low, medium, and high using the 33rd and 66th percentile values as cutoffs. States that are shaded dark blue on the map have both high rent and high disability. These include Nevada and Hawaii, which is not shown. The scatter plot with trend line on the top left shows the relationship between the two measures at the state level. The pattern shows a statistically significant inverse relationship, meaning in states where rent is high, disability tends to be low, and in states where rent is low, disability tends to be high. Next slide, please. Map 5 illustrates the relationship between HCBS and disability prevalence. States that are shaded orange have low HCBS and high disability prevalence. These states are generally clustered in the southern United States. The relationship between the measures is statistically significant and inverse, meaning in states where HCBS is high, disability tends to be low, and in states with low HCBS, disability tends to be high. This concludes my section on the state landscape. I will turn my presentation over to Carmen.
Thank you so much, Anissa. So my name is Carmen Daniels-Jones. I'm a principal in the Atlanta office. I am also an African-American woman with a gold top, orange necklace, black glasses, and I also use a wheelchair. So as we have learned, a person with a disability, as a person with a physical disability, I realize how important affordable and accessible housing is. When I began my career, I worked as an independent living counselor, and I saw firsthand how people struggled to find housing that was accessible and affordable with their SSI as their only source of income. And as the data that was shared indicates, there are 4 million people with disabilities who fit the same profile who receive SSI and cannot afford rent in the United States housing market. The average supplemental security income payment in 2024 is $943 for an individual and $1,415 for a couple. It is the sole source of income for many who receive it, and it is used to pay for everything from housing, food, and transportation. And as Anthony accentuated, it really does not cover everything, so that continues this cycle of persistent poverty. We are thrilled to have 3 subject matter experts join us and share deeper insights that impact the daily lives of people with disabilities. I will share their name, and when they speak, they will introduce themselves. First, we have Barry Whaley, the Program Director for the Southeast ADA Technical Center. Next, we have R. Feynman, Director of Advocacy with Disability Policy Consortium. And last, we have Allie Cannington, Director of Advocacy at the Kelsey. So I'll start off with Barry.
All right. Thank you, Carmen. I'm Barry Whaley. I'm the Project Director of the Southeast ADA Center. And as the last presenter indicated, rates of both poverty and disability are certainly higher in the Southeast U.S., and that's the area that I operate in. Kentucky to Florida, Mississippi to the Carolinas. I'm a white male in my 60s. I am wearing a black polo shirt today, and I wear glasses. So when we think about housing in the legal framework, we need to look at what are the applicable laws that apply to housing? And first, of course, Section 504 of the Rehabilitation Act of 1973. And what the Rehab Act says is that if you receive federal funds from any federal department or agency, you cannot deny people with disabilities an equal opportunity to receive equal benefit and services. So we need to pause for a minute and define what disability is. Disability under Section 504 and the Americans with Disabilities Act says that, and this is a legal definition, is you have a disability is a physical or mental impairment that substantially limits one or more major life activities. The ADA then goes on to, and the Rehab Act goes on to say that you can also have protection if you have a record or a history of having an impairment. For instance, I'm in recovery from substance use disorder. I no longer actively use drugs illegally, but because I have that history and I believe that a landlord has taken some sort of action against me based upon his or her knowledge of that, I may have protection under the law. The third prong of disability determination is you might be regarded as having a disability. And this is more of an impression thing. Perhaps you have some sort of disfigurement that makes you look differently, and you believe that a landlord has taken some adverse action against you based upon that disfigurement. You may have protection under the law. So Section 504 says that no less than 5% of housing units have to be accessible, and 2% have to be accessible for people who have either vision or hearing impairments. And we need to keep in mind, I know that our first presenter had mentioned Section 8. Section 8 vouchers don't necessarily, or they do not, I should say, trigger Section 504 of the Rehab Act. Next slide, please. So we mentioned Section 504. We also have to talk about fair housing, right? Fair Housing Act prohibits discrimination in the sale or rental or financing of housing based on a lot of factors, right? Race, color, national origin, religion, sex or gender identity, family status, but it also includes disability. The ADA, passed in 1990 and amended in 2008, is limited in regard to housing. So it would only apply to housing that is government owned, or student housing, or nursing homes, or homeless shelters. But we need to keep in mind that if there are places of public accommodation within this facility, that could include a rental office or commercial space or recreational facilities, then the ADA would apply in those situations. Finally, I need to mention that there are a number of state laws that apply to housing, and currently there are 49 states that do have state housing laws that protect people with disabilities, and also the District of Columbia. The only state that does not have a state housing law, interestingly enough, is Mississippi, which has been mentioned previously. Next slide, please. So when we look at where discrimination complaints originate, 70% of discrimination complaints occur during the leasing process, and only 70% would occur after move-in. Interestingly, 44% of complaints have to do with a renter's disability versus 35% having to do with the renter's race. Now, keep in mind that there is an intersectional situation here where you might be in a minority population, and you may also have a disability. And in those situations, those intersectional identities may increase the likelihood of housing discrimination. So I need to mention that there are a couple of exemptions to fair housing. One would be if you are a private or religious organization and you offer non-commercial housing, then you would be exempt. Also, if you are an owner-occupied, or if you have a building that's owner-occupied and there are no more than 4 units in that facility or building, then you would be exempt. Next slide. So we need to differentiate between two things. What is reasonable accommodation in housing and what is reasonable modification in housing? So anytime that we change a rule or a policy or a practice to benefit somebody with a disability, to provide an equal opportunity to enjoy a dwelling, then we are providing a reasonable accommodation. So for instance, I may have some physical limitations, and the facility where I live has a parking lot where there are no reserved parking spaces. However, because of my physical limitation, I might ask for a reasonable accommodation to have a reserved parking place closest to my unit in order for me to be able to get in and out of my apartment. You know, maybe somebody has difficulty with going to a rental office and paying rent. We might have some alternate ways to pay rent. What sort of ID is necessary in order to rent? We might make an accommodation if somebody does not have a driver's license, but they may have a state issued ID. And this applies to all housing, regardless of how it is financed. Now, when we're talking about reasonable modification, we're talking about modifying the excuse me, modifying the property so somebody can enjoy the property to its fullest extent. So this might include, as mentioned before, an accessible kitchen or an accessible bathroom or a door opener installed on the front door so somebody can easily get in and out. People who may be deaf or hard of hearing, they might need a visual strobe fire alarm in order to be alerted if there is a problem in the building. So these are the reasonable modifications, and we need to understand that the tenant in this situation would be responsible for restoring the property to its original condition if one of these elements are put in. Let's say I need a ramp to get in the front door. Well, my landlord says, fine, but you're going to have to pay for it unless it is federally funded housing. And then once you leave, you would be responsible for the cost of removing that ramp. Now, again, I want to stress that if federal funds are involved, the cost of modification then falls to the property owner unless it is a financial or administrative burden. Next slide, please. Okay, so there are 7 design requirements that are required under fair housing. The first is a building entrance has to be accessible and it needs to be on an accessible route of travel, right? Because that's the first thing. We have to be able to get in the door in order to use the facility. Second, common use areas need to be accessible. And we've already mentioned that some of that would also fall under the Americans with Disabilities Act, those common use areas. Usable doors, and we're not going to go into all the minutia of how wide a door needs to be or what the slope of a ramp needs to be, but it needs to be accessible for people who may use a mobility device to open the door, get in the door, and close the door. It's important to remember that there are certain requirements as far as the number of pounds of force that would be necessary to open or close the door. The third would be an accessible path of travel in the dwelling. So are there obstructions? Are there things that could make it difficult for either a mobility device user or somebody who may be blind, for instance, and may not anticipate that obstruction? So we need to have accessible paths of travel. Electrical outlets, light switches, thermostats, anything that are controls within the facility should be made accessible so that they are within easy reach by somebody who is a wheelchair user or mobility device user. Also, the next design requirement is that if you are installing grab bars in a restroom or a bathroom, that you need to reinforce behind those walls so that you have a stable and firm bar in order to get in and out. And then finally, as was mentioned before, accessible, that the bathrooms and kitchens need to be accessible as well for wheelchair users. You know, the terrible situation as mentioned before where somebody's arm or sleeve catches on fire becomes an issue. So that's what I have. I just want to give you kind of the legal landscape of what is required. Oh, I'm sorry. Let's mention service animals just briefly. The ADA defines a service animal as a dog, or in some cases, a miniature horse that is trained to provide a service for somebody with a disability. Now, under fair housing, well, and I should mention, you know, sometimes you see service animals with harnesses on that say service animal or whatever. There is no special documentation or identification needed to be for a service animal. Now, fair housing is a little different. Under fair housing, a landlord could ask for documentation that the dog is needed due to a disability. But now I want to differentiate service animal from emotional support animal or comfort animal. Under fair
Barry?
housing, yes, ma'am.
Barry, I apologize. We need to keep moving, and
Okay.
we will be sending these slides out so everyone
right.
will be able to get all the information. Thank you so much for sharing with
Right.
us, and I will turn it over to our Feynman. Thanks, Barry.
Hi, sorry, I just was muted. Hi, thank you to Carmen and Barry. My name is R. Feynman. I use they, them pronouns. I'm the Director of Advocacy at the Disability Policy Consortium. I'm a white person with short-ish curly brown hair, a beard, and glasses, and I'm wearing a gray shirt. So the Disability Policy Consortium is a Massachusetts-based statewide nonprofit that is focused on bringing the voices of people with disabilities into the places that decisions are getting made about us. We have a couple of different ways that we do that, but I'm specifically going to be speaking about our advocacy, especially around housing. Next slide, please. So these are sort of the things I'm going to be talking about. The main housing advocacy that we do is around a program called AHVP. AHVP stands for the Alternative Housing Voucher Program, and it is a state level voucher program that provides rental assistance to low income adults with disabilities who are under 65. It works very similar to Section 8 in terms of it provides a rental voucher. People can take that voucher and move into any apartment on the private market that is within the rent cap. Since we started doing advocacy for it, we've more than quadrupled the amount of funding and also the number of vouchers available, but it's still a relatively small program. There's about 800 vouchers being used across the state right now. And in the sort of course of doing our advocacy for this work, we had a chance in 2021 to use 50 AHVP vouchers for what we called a nursing home pilot, which was to get people who were stuck in nursing homes out of nursing homes and into the community. It's a fairly common problem, at least in Massachusetts, but I'm pretty sure probably everywhere, that people wind up in nursing homes and while they're there, lose their housing for one reason or another, and then can't be discharged because they don't have anywhere accessible to live. And so this, we were hoping to, which is a violation of the Olmstead Law. Massachusetts recently entered into a settlement about this very issue. But in doing this, we sort of were able to work with 50 people from getting a voucher to leasing up an apartment, and we were able to really see several of the issues that we have started to advocate for to improve it. One of the biggest ones that we've found in terms of advocacy that we're working on is in Massachusetts, at least, we talked about the requirement for there to be a certain amount of accessible housing or accessible units within an apartment building, but we did not talk, and there is also a requirement for a certain number of affordable. But in Massachusetts, at least, there isn't an overlap of affordable and accessible requirements. So we could have all of the accessible units are costing $3,000 a month, and none of the affordable units have a bathroom that a wheelchair user could use. And as we talked about, so many disabled people are living on SSI or SSDI or other fixed incomes and can't afford that $4,000 unit or $3,000 unit. So that is one place that we've been doing a lot of advocacy. Also, one of the things that we've found is that for people who hold these vouchers, there is a certain amount of people saying, you know, if you go to a place for housing assistance, you're not there. It's not a person-centered process where instead of saying, what do you need? How can we help you get it? Often the response is sort of, oh, I see that you have this kind of disability. So here's what we give to people with this kind of disability, regardless of whether you need it or not. And this can lead to sort of both a misallocation of resources and a lot of frustration of sort of, you know, for example, one of the community members I work with, who's currently looking for a home, the person who she's working with said, oh, well, a person with a walker lived in this apartment, so it should be good for you. But she uses her walker for a different reason. And so she's not able to go without her walker in the bathroom in the way that the previous resident could. But it's hard to get people to listen to her. So one of the things I just sort of want to state in general is as we work on housing for people with disabilities, I think it's really important that we remain flexible and open-minded to the needs of the particular people living in it. Our advocacy is done by and guided by people with low-income people with disabilities who have experience. Sometimes Olivia joins us, who have had experience with housing insecurity or who are currently experiencing it. And I think it's really important as advocates that we continue to do that, and that people who live in affordable housing are consulted. I'm going to pass it along to Allie. Thank you very much.
Thank you to everyone who's come before me in this jam-packed agenda. I'm so grateful to be here. My name is Allie Cannington. I am a white queer person with glasses and short curly hair. And I am the director of advocacy at the Kelsey. Next slide. So the Kelsey is an organization that is co-led by people with and without disabilities. And we both create housing on the ground that is affordable, accessible, and inclusive. And while we create housing, we identify the market and policy conditions that need to change so that what we call disability forward housing becomes the norm across the country. And, you know, today we've talked a lot about the challenges, the crisis that we're in, that we're all feeling in different ways as people with and without disabilities, but as disabled people, myself included, we experience at least one or more barriers more acutely when it comes to the housing crisis. And at the Kelsey, we are not just addressing the crisis by changing policies and solutions, we are actually creating the types of housing that can transform not just disabled people's lives, but everyone's lives and the broader communities. So we know the problem, so what is the solution? What we call disability forward housing is what we call the solution. And that is anchored in 3 core principles. One is affordable. what we've talked about today. So the solution needs to be housing that is affordable to all income levels, and a particular assurance that that homes are affordable to those on the lowest incomes or no incomes, including people who rely on SSI as their sole source of income. It's housing that's accessible, not just meeting the requirements, but actually creating a cross-disability accessible homes where cross-disability design is embraced to support diverse access needs, and where housing is located with access to services, amenities, and transit. And we've talked about, you know, the unmet promise of the Olmsted Supreme Court decision, which mandates that disabled people have the right to live in the most integrated setting. And therefore, we need to ensure that housing is inclusive. At the Kelsey, we define that as integrated homes for people with and without disabilities who use supportive services in their own homes with on-site programming, amenities, and staffing to support inclusion. So often we may have people with disabilities who may live in the same building as people without disabilities, but there's still lack of equitable access to all amenities and services. And so we're not just talking about integrated, we want it to really level up and talk about, you know, inclusivity. And that is a core part of disability forward housing. Next step and next slide. Just want to anchor in how we think about at the Kelsey whenever we are developing as a co-developer this housing, or we're advancing policy solutions or shifting the field. We always come back to the triangle of support, what we call it, that we need housing, that we need community, and that we need supports and services. And again, you know, Ellen talked about this at the beginning. Next slide. So how do we do this at the Kelsey? We build housing, as I mentioned. We advance the field. So that means we support housing industry leaders to understand the issues and resource them to embed disability forward housing into their own design, development, and funding initiatives. One of the ways we do that is by having this incredible tool that is, again, co-created by people with and without disabilities called the Inclusive Design Standards. And I'll ensure that folks who are joining today get a link to find out more about those standards. And then we agitate the systems, we change policies at the local, state, and federal level to ensure that that government is held accountable and becomes a bigger payer in this severely underinvested supply of housing that we as a nation you know, have a responsibility to create across, no matter where we are. Next slide. So what have we achieved to date? I'm not going to go over the numbers here, but we're really excited about the 303 homes in our pipeline. So this means that housing that we are co-developing and operating. And we, although our home base or home office in San Francisco, we operate nationally through both co-developing housing, providing technical assistance, and changing policies. And the most critical piece here is that we cannot do this alone. And I want to just spotlight our most recent development, and we've just been around for about 6 years at the Kelsey. Next slide. I want to spotlight the Kelsey Air Station. This is 115 homes, housing 153 people with and without disabilities and their families. And our residents are coming from all walks of life, including 10 years of housing searches, homelessness, and accessible environments. And I want to just lift up a core part of our housing model, not just the accessibility, not just the affordability, but how we embody inclusivity is not just ensuring that people with disabilities who need supportive services, whether that's 4 hours a day or 4 hours a week or 24 hours a day that folks have the ability to live and thrive in the Kelsey Air Station. But we also have the inclusion concierge, which is a core part of our property management and what we call resident services team that is really steeped in the different service systems that people with disabilities need to navigate. And we're so excited about kind of this, we're excited about all our work, but excited about what the inclusion concierge element can teach us both about how we create more person-centered and inclusive housing that doesn't, again, just benefit people with disabilities, but benefits all the residents. The inclusion concierge is for all of our residents, people with and without disabilities. Next slide. We cannot do this work alone. We are getting way too many inquiries that we are able to fill. And so each one of us has a critical role in advancing a disability forward housing future. And I'm excited for you all to join us. Over to you, Carmen.
Yeah, thank you so much, Allie. This discussion was very rich and we really wish we had more time. So I wanted to just, in the time remaining, to ask a few questions of R, Barry, and Allie. And since we have 4 minutes, your responses need to be kind of quick. So one of the questions is, what roles can healthcare organizations and companies, including HMOs and MCOs, play in advancing disability forward housing solutions? Allie, I'll toss that to you.
I'll speak really quick on this. Because government has really failed to invest in this commensurate supply of housing for people with disabilities, as a developer, we are always needing to close our gaps. So that means the difference between the cost to build and operate an affordable property and the revenue generated through affordable rents. So MCOs, I want to lift up how MCOs across the country are becoming investors, below market gap investors, to help us finance, well, not yet with the Kelsey, we hope to partner, but really MCOs and affordable housing developers can work together as financing partners to help in this extremely challenging financing market. And lastly, healthcare organizations need to level up, get educated in the various forms of home and community-based services and integrated housing opportunities for people with disabilities so that disabled folks can get the full spectrum of options that are available and that they have a right to, and so healthcare organizations have the responsibility to deliver that information to their patients.
Thank you so much. Are there any questions from the participants that are with us? Okay, so hearing none, I saw that you turned on your camera. So was there anything you wanted to add?
Just a little bit. Some healthcare plans in Massachusetts offer housing search support or moving support as part of their health insurance. And I think that that's really exciting. And I think the idea, since housing is so closely tied to health, I think the idea of some amount of housing search support or, housing residency maintenance support can be a really powerful way of healthcare organizations, health insurance organizations working together on healthcare, on housing.
Thank you, R. So with 1 minute left, we just want to thank you all for spending an hour with us. We are open, the team at HMA is open if you have any questions or want to understand better what we can do for you to create opportunities to develop this concept around health and housing. And so with that, we're right at 1 o'clock. We'll sign off, and we will be sending the slides to everyone who registered. We will send the slides, and you all will be able to get in touch with us when and if you have questions. So thank you to my colleagues. Thank you to R, Barry, and Allie, and also to Ellen. Y'all have a good day.